Hello, I'm Dr. Jayalakshmi TK. I'm Senior Consultant Pulmonologist at Apollo Hospital, Navi Mumbai. Today, I would like to talk to you about asthma and COVID. So, I hope all of you are doing well. We are into the second wave of the pandemic, and as we can see, that this second wave is at present receding. And we have been observing our patients with asthma over the last 1 year since March, since we started getting our patients with COVID. So, what we are seeing is that patients with asthma are not at a much higher risk of contracting COVID as compared to the regular patients. In fact, asthmatic patients are a little more careful and vigilant, and so we are not seeing a very high incidence of patients with asthma who are getting COVID. Even in those asthmatics who have got COVID, we are seeing the same trend of severity of COVID in these patients, and it is not a comorbidity which leads to more severe COVID. But in patients with asthma who have a more severe asthmatic illness or a chronic asthmatic illness, we are finding that their symptoms are more, especially if they have a more lung involvement, more severe lung involvement due to COVID 19. Also, what is being seen is that the inhalers which are used for asthma, especially the steroid-containing inhalers, are found to be beneficial in COVID. In some studies, they have shown prevention of lung disease to more severe lung disease in COVID patients. In fact, budesonide has been advocated for use in treatment of mild COVID, even in those patients without asthma, by the Indian government guidelines. And hence, patients with asthma should continue to use their regular inhalers and their regular medications. There is no fear of using inhalers or a fear that using inhalers might worsen COVID or increase chance of getting COVID. Another thing is the asthmatic patients should be more careful about hand washing, social distancing, avoiding crowds, avoiding unnecessary travel. These precautions have to be followed more stringently in view of the underlying asthmatic disorder. Another point about vaccination. Many people have asked me whether vaccination is safe in patients with asthma, particularly those who are allergic. Mostly asthmatic patients are allergic to dust or to fumes or to pollen or some food items, maybe even to some drugs. So, so patients with asthma need not fear about taking the COVID vaccination, although they have these prior allergies. Only patients who have had a severe anaphylaxis or an anaphylactic reaction to previous vaccinations, they have a higher chance of anaphylaxis at present, and they may need to avoid the COVID vaccination. The routine allergies to dust or smoke or even the normal drug allergies are not a contraindication for taking the COVID vaccination. So please go ahead and take the COVID vaccination as per the schedule. In fact, COVID vaccination is more required because the asthma patients are in a high risk group for getting a more severe infection. So that is one thing. Also, friends, please go ahead and get your influenza vaccination because a normal flu can also trigger off a severe asthmatic attack. So if you're due for an influenza vaccination, you can get that. Don't stop the routine medications, and try to do an online consultation where possible. And also the need for regular PFTs may not be there unless indicated. Pulmonary function tests are being carried out in Apollo with due precautions. So if and when required, it can be done. Another thing is sometimes when there is fumigation or cleaning of the rooms, the fumigating agents or the cleaning agents or disinfectants which are used, or even sanitizers, sometimes asthmatics may get triggered. The asthma attack may get triggered by the fumes or the strong smells. So these may need to be avoided. You may need to use a sanitizer with a minimal fumes or those which are suitable for you, or just stick to soap and water for cleaning the hands. And also you may need to clean the room or use the sanitizer or fumigate the room or disinfect the room with the asthmatic patient being out of the room, or may have to be get it done by some other person. So these are the routine precautions which need to be taken. Asthmatic patients, the bottom line is continue using your inhalers, they're good for you. Continue using the regular medications. Have a stock of medications with you, 1 or 2 months medications at home for in case of emergency, and if you're not able to procure, or if you have to go into a home quarantine. Otherwise, you're not really at a very high risk for getting more severe COVID infections. So take your vaccinations and take care. Thank you.